though most effective in the first 72 hours. Those are 3 days. So, but like I said, there's no 100% method. One, the 100% method depends on what product you're using, when you have used it. Sometimes where we buy our products, are they up to standards? Some of these products are supposed to be kept under particular temperatures, and they expired, or we just walk into a drug shop, a pharmacy, and we buy. And when we buy, are we sure about their expiry dates? Are we taking it in the particular time? So my answer is a yes. You can take the pill and still conceive, and it has happened before. Okay? Yeah.
To these methods that we have talked about, how true is it that they can cause barrenness?
I think it goes back to infertility. Not barrenness, I think, is more or less you can't have children. But that is false. You can have children for as long as all the rest are still constant and normal. Okay?
About normal period cycles, is it safe for a 24-year-old girl to get her periods after 2 months?
Some people have longer cycles, like we said earlier. Some people don't have regular periods, but it also depends. Has she been having her normal cycles? If yes, did she take any pill, or did she take maybe any hormonal method? That could be the first question, why her periods have delayed. But it could also be that she's not seeing her periods regularly. If she's not seeing her periods regularly, then she needs to visit a health worker. If she has not, it's 2 months now, she's not seen her periods, and she didn't use anything, and she has been sexually active, what would be the most obvious answer? Maybe she's pregnant. Okay? So, if it happens, the best way to handle is visit a health worker, and you rule out all the other causes.
What circumstances may prompt the use of the C-section?
May prompt the use of C-section? Many. Some people ask for the C-sections themselves. They don't want to labor. Others could be eclampsia. Eclampsia is high blood pressure or low blood pressure that puts the mother at risk of losing her life. It could be the baby is so small. It could be lack of baby. It could be baby being not in good condition or stressed, or like the baby's life is threatened. It could be your pelvis is not adequate for you to have a normal delivery, so the only option is to do a C-section. Could be, there are quite many things, but those are the commonest. I can't exhaust the list. Yeah? Yes.
I believe climax days are days when secondary...
Come again?
I believe climax days are days when the secondary zygote is expected to be released in the oviduct by the Graafian follicle. So are women still in the unsafe days even after that? I thought after ovulation they are unsafe.
I think that one I answered it. It's actually during ovulation that you're unsafe. It's after ovulation that you're safe, and chances that you can conceive is very minimal. But, like I said, what are your cycles? All we are talking about depends so much on your cycles. If your cycles are between 28, 26, and 32, then it's much easier to manage. But if you have short cycles or long cycles, you can think you're still in your safe days when you're actually ovulating. Okay, I just wanted us to talk about, thank you so much. Clap for her. You can have a seat. I just wanted us to talk briefly about the predisposing factors for reproductive cancers, and these may cut across for both male and female. Am I still within time? Okay, good. One, it starts actually when we are young. I'll start with the girls. It starts actually when we are young. We start having sexual intercourse when we are still young. Our reproductive organs are not fully grown. Eh? You know what it means. Just young. So, do you know some people start having sexual intercourse even when they are 10, 12, 14? Okay? Having sex. I wanted to give an example of any single plant you can choose to choose. As it grows, as it starts to grow, it's still fragile. But as it grows, the stem becomes thicker and stronger. Yeah? So maintaining that tree becomes much easier than when it was a few weeks or a few months. The same thing applies here. If you're still young, your organs are still growing. Some people are even having sex when their breasts have not even coming out. They have not yet come out. So you realize that their cervixes get affected. 2, multiple sexual partners. I mentioned that earlier. Every month I have a new partner. First of all, I have started having sex young. I'm talking about predisposing factors. Puts you at risk of... Am I talking? Ngamsirikiridde. Mutidem. Temtia. So, just to give you a hint of a few of those things, but we usually encourage, when you clock it, you screen once every 3 years. For as long as you have started having sex, if you have never had sex, the risk is less. Do we all know how we get, for example, cervical cancer? It's through sexual intercourse. The men are transporters. That's why I'm talking about multiple partners. They will pick it from Sarah, bring it to Diana, from Diana to Chisache, from Chisache to Pamela. So it is through sexual intercourse. And so my encouragement would be, if you must, at least use a condom, Kale, so that you reduce on the risks. Though a condom means up to 100%. That is if you could use it correctly and consistently. So those things of saying maybe family planning causes cancers, false. Do you realize that these days reproductive cancers are actually becoming very common? They never used to be very common with our grandparents because of our sexual behaviors. Sometimes we have run away from our cultural way of doing things because of our sexual behaviors. We start having sex early, we have multiple partners, we are doing unsafe abortions. You're putting yourself at risk. But 1, just change your lifestyle. 2, when you have an opportunity, if you're HIV positive, make sure you screen at least every year. If you're HIV negative, once in 3 years. Actually, what we do, for anyone who comes in for an IUD, because it's the same procedure and has never screened for cervical cancer, It's mandatory for as long as you're 25 years and above. If you're HIV positive and you're below 25, that also depends on when you first had your first intercourse. If you come in for an IUD, you're above 25 years, you are not HIV positive, and maybe you started having sex a year ago, over 6 months ago, we may not screen you because the risk is minimal. Okay? So that's why I say, look at yourself as an individual. Don't compare yourself to another person, and make sure you're actually taking care of your health. Don't depend on others. Thank you very much.